who is the coordinator of the IDLE project, I will give you an overview on our main dissemination activities. So today's webinar is slightly different to the others ones before, as we will not present any new methods. This was the content of the 10 lectures before. Today we will show you where you can access the output generated within the IDLE project since the last 3 years. In this respect, we are really very grateful to the European Union having given us the opportunity to develop new statistical methods and tailor it for their use in small populations, such as for rare diseases and orphan drugs, drug development for children, or for targeted therapies in the context of personalized medicines under the 7th framework program under agreement number 602552, as you can see on the first slide. It have been indeed quite intensive 3 years, and it was a great honor to work with all the people shown on this slide and the various researchers at the institutions. And conducting a trial is not simply doing a bar calculation, let's say for the t-test, and performing it afterwards in SPSS by just clicking through SPSS. In the last 3 years, we tried to bind the topics headed in the various work packages closer and closer together, and hopefully some research results out of the IDLE project will also be helpful for your future research. So where and how can you make yourself more familiar with our results? So let's start with the most important thing. As you might know, the EU funded 3 projects within the FP7 framework called on small population. And as all projects will end the next month, there will be a joint workshop on small population to present the main results of all 3 FP7 projects together. And it's really great that the European Medicines Agency kindly offered to host this meeting in London, UK next year. So I'm really happy today to announce that IDL will have a joint meeting with Asterix and Inspire at CMA next year. So at this meeting you can not only familiarize with the results coming out of IDL, but also you will see the main developments from the other 2 projects as well. As said, we are really grateful to the European Medicines Agency, particularly to Ralf-Dieter from the pediatric team, to give us this opportunity to present the results of all 3 projects together. And a steering committee has been set up, which is chaired by Ralf-Dieter and the 3 project leaders, so Ralf-Dieter Hilgers from our project, Michael Stallard from Inspire, and Kit Reuss from Asterix. And it will be a 1.5-day meeting at CMA in London. Unfortunately, the date hasn't been entirely fixed yet. We will have a DC of steering committee next week, and hopefully there will be more news shortly, but we expect that it will be at the end of March, maybe beginning of April 2017. And all relevant stakeholders should be represented at this meeting. So not only researchers from the 3 FP7 project will be there, but also advisory board members, regulators, patient representatives, clinicians, industry, CROs, academia, and methodological researchers in small population field. The topics to be discussed will include level of evidence and decision theoretic aspects, extrapolation, study endpoints, innovative designs like adaptive designs, modeling and simulations, pharmacometrics, and evidence synthesis. So if you want to know more details, then register immediately for the IDL newsletter, as further news on this workshop will be published in our next IDL newsletter. This brings me already to one important dissemination activity shown on slide number 6. So we had biannual newsletters where we published all news and also the abstract of all published papers. So as said, if you haven't done it yet, please register, because we will publish more details on the joint EMA meeting quite soon. And so far we have already 300 subscribers, but as the project has been prolonged, there will be 2 more issues coming out in the next months. So one will be published at the end of this year and another one at the end of the project in April 2017. And many thanks to our editors, Gerald Lawin and also Diane Uschner, who did really a great job in putting all the information together and sending the newsletter out. So, Gerald and Diane, vielen Dank. And on the next slide, you can see that by our dissemination activities, we really reach people outside our institutions and networks. We have subscribers from the whole Europe, but also from Argentina, Canada, US, over to India, New Zealand, and Japan, just to mention some. And the numbers are still changing as still people are registering for our newsletter. On slide number 8, you can see a list of all dissemination activities which we think were important to distribute the results into the clinical trial community. A central source is our project's web page. I will have a few words later on, but we are also extremely thankful to our advisory board who gave us not only scientific input, but also helped a lot with the connection to reach other people and institutions. So many thanks in this respect to them. And also our young scientists were a key factor in being successful. Not only did our youngsters deliver excellent research, they also organized themselves and liaised with the youngsters from the other projects and institutions. This was also linked with study stays abroad time to time. Important for any scientific research project are the papers published in peer-reviewed journals, and when possible, we try to link it with freely accessible software. We had various presentations, not only at conferences, but also at regulatory agencies such as US FDA, PMDA in Japan or EMA. In addition to our IDLE webinar series, we were invited to online lectures of the American Statistical Association, PSI, and the Royal Statistical Society. We not only had collaboration within the IDLE project, but also to external partners. Many thanks, for example, to Inspire and Asterix for the excellent collaboration in the last 3 years. In addition to the more traditional dissemination ways, we also try to be present on social media. So you can also follow us on Twitter, where we have now about 300 tweets, or on LinkedIn. So let's start with the more traditional way of dissemination, our webpage. If you haven't done so, please visit our IDLE webpage so you can see the URL on the top of slide number 9. There you can find an overview on all IDLE activities and outputs. The webpage will be maintained till 2020 and updated whenever something IDLE related is happening. For example, any new publication or R packages will immediately go on our webpage. And if you go to the section IDLE output, you will find a long list with all of our outputs generated the last 3 years. You will find direct links to papers, comments, and so on. A special thanks again to Diane Uschner and also to Oliver Christ from the Aachen team for the input to the web page. As far as publications are concerned, we have now 40 papers published in peer-reviewed journals, and you can easily access them because most are open access, and the range of topics addressed is really broad, as you can image by the names of the various work packages, but it also ranges from new, very technical papers to more applied and applications. Further papers will follow. There are, for example, 5 papers on preprint servers such as Archive, and others have just been submitted to journals. As far as more general and review papers are concerned, so far we have 5 review papers published. For example, the paper by Hilgers et al., so the second one on the list, is a joint work of the 3 project leaders of IDLE, Asterix, and Inspire, where the coordinators outlined the plans for each project and this is also the basis for the joint EMA meeting to present the results next year. Another highlight is the 25 years of confirmatory adaptive designs paper, which is listed as featured article in Statistics Medicine with invited discussions of the FDA statistician and other well-known statisticians such as Willy Maurer from Novartis or Cyrus Mehta from Cytel. Nowadays, it would be a pity if new methods were not applied simply due to missing software. So a real milestone is a freely available software where you can see a list on slide 12 to make it more understandable. For example, the R package on randomization is supported by a YouTube video illustrating how it should be used. You may have a look at this video of Diane afterwards. Another important dissemination activity was that we gave regularly short courses on various topics, from very specific ones as adaptive designs, N-of-1 trials, randomization and stratification, surrogate markers, longitudinal and incomplete data, to more general, as for example statistical issues in drug development by Stephen Sen. To make yourself familiar with a new method, a 15-minute presentation at a conference can only be an appetizer. Thus, we happily offer further short courses and webinar trainings on IDEAL-related topics on request. So if you're interested in organizing a short course, please simply contact us via email or send an email to a particular work package leader you're interested in. So on the next slides, you can see some of the upcoming short courses with ideal contribution, and hopefully there will be some more till the end of the project. So the two listed here, one is in the United States in December, and the other one is next week in Austria. On slide 15, you can see an overview of conferences or workshops organized by the IDEAL consortium, or at least with relevant IDEAL contribution. As already announced, next year there will be the 1.5-day workshop at CMA in London. A highlight in 2014 was a public conference at the Isaac Newton Institute in Cambridge. Here, many thanks to our advisory board member Rosemary Bailey, who initiated this great public one-week conference, and at least I enjoyed this conference in Cambridge very much. So thanks to Rosemary and Dieter Hilgers again for having organized this wonderful event. Also, in the beginning of the project, we had a big joint symposium together with Asterix and Inspire to coordinate our activities here in Vienna. And there were also some half-day seminars organized with IBS in the last years. The most recent one, just after our yearly assembly at the beginning of November together with Asterix here in Vienna. The collaboration with the other two projects is also stressed on the next slide, slide number 16, where some of our external network is listed. So Dieter was in close contact with Kit Royce from Asterix and Nigel Stallard from Inspire. They did not only write joint papers, but they also gave joint presentation to raise awareness on statistical methodology for small populations. There's now also a close link to the IRDIC task force on small population, where, for example, Dieter is a member of the task force, and there have been already several activities. Another very important part of our network is the European Medicines Agency. Many thanks, in particular, to our advisory board member, Ralf Herold. And during the project, we had several interactions with the EMA. For example, we not only contributed to discussions, we also gave presentations at CMA, and in addition, we also wrote comments to guidelines as listed on this slide. An important part of this project was extrapolation, and we discussed our ideas on various occasions with CMA. And I think some of the ideas might be taken up as Christoph Malle, who is the work package leader of Dissemination, who unfortunately can't be here today, was also involved. He was also involved in the draft concept paper extrapolation at CMA, as he was the Austrian PDCO member. Again, you can find our written comments on our ideal output webpage under Input to Regulatory Documents. For example, now you can see comments we submitted under the lead of Stephen Sen on the draft subgroup guideline. And if you now have a look on the comment on the bottom, I'm not sure if all comments were always well received, as some are also quite critical, as you can see. And just recently, we commented the draft guidance in oncology together with the Horizon 22 project ideas, together with Thomas Jacke and Xavier Paoletti, so many thanks to them. And some of the comments might be out of scope, as it turned out that the EMA only sought input for a very specific section of this guidance, but our comments show that it could be worth revising the whole guidance, as some things have changed over time. So if you know any other guideline which is currently out for consultation, please let us know and we can think of commenting it in the upcoming months. We also explored more dynamic means to reach a broader audience than scientific publications. For example, there's a growing opinion that p-values give researchers the impression that treatments are effective too easily. So if that is the case, then sample sizes for conventional trials may well be too small, let alone for those in rare diseases. And in the following posts, ideal team member Stephen Sen takes a critical look at the claim. For example, have a look on comment on error statistic, the pathetic p-value, or double jeopardy. Jeffries upholds the law. And if genetic variation is a major component of drug response, then developing treatments for rare diseases may be even more difficult than supposed. And in the blog post on painful dichotomies and despondency myth of personalized medicine, Stephen shows, however, that the element of individual response may be commonly overestimated. So if you haven't read the blog post yet, I can only recommend doing so. So don't waste your time in this webinar. Go and read Stephen's blog post. As said, only the ideal output webpage. As said, on the ideal output webpage, you will have direct links for your convenience so that you can easily access them. Stephen, you're welcome. As said, a key factor for any research project to be successful are the young, talented researchers being involved. So many thanks to all of them again. And in addition to the scientific part, they also helped us to disseminate the results. The liaisons themselves with the young researchers from Asterix and Inspire. So on the first bullet points, there should also be Inspire listed. And they organized their own meetings. They constructed a network of young biostatisticians in industry, regulatory agency, and academia. And hopefully they will spread the ideal methodology at the future workplaces. And on the next slide, number 23, you can see how some of the careers have developed in the meantime. So they have been offered jobs at pharmaceutical industry, at regulatory agency, or also at HTA bodies being responsible for pricing of drugs. Again, many thanks to all our youngsters and good luck for your future professional lives. Now it's almost time for me to say goodbye. If you want to stay in contact with us, ideally you visit the webpage, follow us on LinkedIn or Twitter, or simply send us an email. That's all from me, and I will hand now over to the big mastermind of the IDLE project. The coordinator himself, Professor Hilgers, will now continue. Dieter, I hope you are online and you will guide us through the last few slides. Just give me a few seconds to check if Dieter is online. So on the picture now shown, you can see mainly the work package leaders and some of the members of the advisory board. And Diane, if Professor Hilgers has technical problems, I can also go on. Just advise me.
Okay. Okay. So I hope everybody can hear me now. I have had a small technical problem that seems to be with my computer. So anyway, so on this transparency, you'll see a meeting of all happy people meeting in the last week in Vienna, a meeting which was organized by Franz and his teams, and I'm very thankful for this hospitalization. And so we had made a big big step with combining our results, and we have learned about what we derived in the last 3 years. So that was a very successful meeting for us. And we are very happy, as you can see, looking forward for doing our job in the next year. From my personal point of view, I would like to thank all the researchers and organizations who have supported the IDEAL project in the last 3 years. I think the project has a very great success from various areas on. And Franz, thank you very much for summarizing our dissemination activities in various areas. So I think we reached a lot of people already. And I hope we can continue this in the next year when we meet at DMA together with the Asterix and Inspire project, led by Kit Roos and Nigel Steller. So I thank Gosia, I thank Cafe, Holger for his contribution, Eva for managing all this stuff, Nicole for doing research and combining all this and sharing all these activities of the IDEAL project. I thank Franz for his contribution to Work Package 4 and his dissemination activity, Mats from Uppsala University for his contribution, and also Christoph. Franz from the INSERM for her contribution to the Work Package 5, and last but not least, Gert Molenberg from the University of Hasselt and Stevenson from CRP Santé, which now is the Luxembourg Institute of Health. And also, I would like to thank the very enthusiastic external advisory board. They stimulate a lot of discussion within the project. They stimulate a lot of ideas, and they bring a lot of ideas from patient perspective, from clinical perspective, from math perspective on. And here you see the names: Ségolène May from Paris, Rosemary Bailey from St. Andrews University, Paolo Baroldi from Washington, Frank Braitz from Basel, Novartis pharmaceutical company, Thomas Brozikowski from Cambridge in the US, Martin Foster from Helsinki in the UK, Ralf Herod from the EMA in the UK, Chris Dennison from Bath University, Stephen Julius from Sheffield University, Gerald Nguyen, who brings the patient perspective to us, Paolo Pertile from Verona University, Gerard Pons, who was missing at the Vienna meeting but was present in the other meetings, and I like the discussion with him very much. William Rosenberger from Fairfax, who does a lot of work with us together, stays for half a year in my department and stimulated a lot of discussion. Shia Sabrati from Stanford University, Günther Smalzing, who brings the ethical points of view to us, and last but not least, Franz Wassmer. Well, I have to say, when I look to the webinar, that we presented selected topics in the webinar series, which were developed in the last 3 years. But there are much more results which can be found in the papers, and please take a look to the papers on our web page. And I'm very sure, because I know what progress we will make in submitted or in papers which are under preparation. So there will be much more result within the next months. And please take a look to our website about the current state of our publications. And from my point of view, a major step will be the joint meeting at the EMA next year. And if you had missed one of our webinar series, please, I would like to refer to our web page again, because on the web page you find all the webinars, and we have YouTube videos from all the webinars, as well as the presentations. And so you can stay in contact with all the work package leads. You can send an email or download the presentation. And if you have questions, we are very happy to answer these questions in the future. Okay, so that's more or less from my side. Thank you as participants for our webinar series. I'm very pleased that you follow almost all of our webinars and spend your time, and I'm looking forward for your comments probably in the future, and looking forward to seeing you. So from my point of view, I would like to say goodbye. And now you have me also on video. Greetings from Aachen. Thanks for listening. And, well, thank you in the name of the whole Ideal team. It was a pleasure to have you on board. Bye-bye. Take care.